Now, I'm going to give you my version of a nurse that's been a nurse for a long time and my priorities and what I came up with. At this stage of the game, I am not worried about whether yours is exactly like mine, okay? Because I know you guys don't have that same thought process that I have, okay? So I'm going to list mine out, and you can kind of, if you want to pencil what I prioritize down for this case study, or you don't have to change yours, okay? So my first label that I came up with was ineffective airway clearance, okay? Respiratory, what's my priority here? Yeah, okay. So my priority is, can this patient cough up with COPD? They can't get the carbon dioxide out like they should. They're not able, she's got a dry cough, you know, her pulse rate's high. We don't know what her lungs sound like. She's possibly with her fever, has a secondary infection going on. So when I look at ABCs. The second one, which you're going to see mimic, I went ahead and labeled it, even though I went ahead and put it down, was impaired gas exchange. Okay? And you can disagree with me, that's fine. The one thing with students is you give me rationale, that's great. The third one I did, and I just kind of went along with what was on your COPD, because I don't have enough information on this patient. If you noticed on COPD, it had an imbalanced nutrition, less than body requirements, and we're going to talk about why that's a big deal in just a little bit, okay? I put that as my number 3. Then I also put after that risk for infection, and I'm going to talk about that a little bit more. Risk for infection, deficient knowledge potentially, because I don't know if this patient, you know, isn't taking her medications and things like that. And then risk for unstable blood glucose level, and that comes with the fact that she's a diabetic. And do y'all know anything about diabetes and stress and being sick and all that? Huh? Do you know what happens to someone's blood sugar when they're sick? It goes up. Now there are other pieces, and we could list 20 different diagnoses. If you have something different, that's fine, okay? Right now this is just a learning process. So those are my priorities. So when I think about prioritization, I think about, go back to that sheet that I had on there. Think if it goes untreated, could it result in harm? If I don't treat the respiratory problem that this patient has, what can happen? Could they die? You think? Okay. So when I'm prioritizing, that's what I'm doing. So what I wanted you to do with whatever labels you chose, and if you want to ask us, do you think I'm off? You know, if we think you're right or whatever, that's fine. This is to learn the process. So I want you to take that first label that you found. So ineffective airway clearance is mine. Find your label, and I want you to go find your common related factors in your book, okay, on that first label. Okay. Now, when we list related factors, we don't have to list everything that's in the book. We're going to list what is relevant to our patient. Okay? So has everybody, I see, so under COPD, if it is the ineffective airway clearance in the new book, it was on page 444. The old book, I'm not sure. Or wherever, huh?
434.
434 in the old book. What? What'd you say?